Good day, folks. Thank you so much for joining us. Today we have with us Shiyen Shu, and I hope I got the pronunciation right. And if I didn't, she will correct me as well. She came to Canada in about 2000 and then has a very interesting journey. And so, without having me to introduce her, let her, Shiyen, if you can get started by giving us a little bit of an introduction about yourself first.
Sure. Thanks, Saad, for having me here. Pleasure to be speaking with you, sharing my journey. So I came to Canada in August of 2000. Actually, ended up coming here right before, we landed here on August 14th, 2000. So right before India's Independence Day. So I came from India and I came with my parents. So I was 16 at the time. We came as a family and we arrived in Toronto and it's we always dreamt of going abroad. Like ever since we were kids, this was the first time we were coming to Canada. We had never seen Canada. We had never gone to the US, anything like that. So it was very exciting. But I would say that what when we came here was very different from what we thought it might have been. Like there were lots of challenges, lots of difficulties, just getting used to the new country, the new culture, everything here. My parents actually separated when we arrived here, so that was an additional challenge that sort of as a family we had to go through. But on the whole, the journey has been so great. Like I've learned so many lessons. It's been it's been a really nice I think learning experience. And Canada is a great place once you learn how to work with what is around us, the system, seek the people, the experiences to enrich what you are trying to achieve in your life.
Amazing, amazing. So, currently, where are you in your current role right now?
So I'm with the company actually just changed names again. I'm in the healthcare sector. So I've been in the healthcare sector for most of my career actually. I started off as a frontline clinician, as an occupational therapist, so that was my master's degree. And I'm currently with what is called Home and Community Care Support Services. So it's the home care sector. We're funded by the Ministry of Health. So we were funding, the hospitals, and we were funding community care. Right now, there's a lot of changes happening in healthcare itself. So we are responsible for the home care in our community. So people living at home, in terms of supporting them for therapy, so physiotherapy, occupational therapy, speech therapy, or like personal support workers, that kind of thing, to keep them safely at home so that they don't have to end up going to like a nursing home, long-term care, or going back to the hospital. So that's kind of our mandate as an organization.
And in terms of, like, I know there was an aging population issue, and I think that is still the case in Canada. In terms of where the profession is headed, what is your take on this? And yeah, what would be your take on the profession itself?
So healthcare has a huge scope. If you are interested in the field of healthcare, there's tons of opportunities. It depends on where you want to be going. Like, do you want to be doing frontline clinical work? Do you want to be doing more like project management, more administration? Like wherever your interests lie, but there's always opportunities. And healthcare is a small world. Once you get in, it's quite easy to move around. Also, depending on which sector you're interested in. Are you interested in like the hospital sector, acute care, where I have worked previously, or like more the community care? But there's huge scope. Right now we're short staff. When we look at our clinical frontline workers, we don't have enough. We don't have enough nurses. We don't have enough PSWs. We don't have enough therapists. So we need more. We need more staff there. And there are actually programs being launched now where international graduates coming from those fields are getting like some kind of expedited visas or something to fill the need that we have here in Canada. But there's huge scope.
So you think there is, like for all those new immigrants, your advice would be to consider this as an option as well?
Yeah, most definitely. So I've, in my own experience, I've mentored a lot of international immigrants here who've been, doctors back home, and they're coming here, and it's very difficult. It's very difficult coming to Canada with that international degree. And sometimes they come here and they might choose to go that, same medical route, so writing the exam and clearing all of that. I've had, somebody I know who's cleared the exams, but it's so hard getting, that practical experience that they need to then start working here. So in those cases, they might then, do a degree in healthcare administration, in management, or they might choose a therapy profession or an allied health profession to start working, so there are other opportunities. The difference in Canada, I would say, from from back home, like other countries, is that there are a lot more diverse fields here, occupations that are not so known, back home where we came from.
Absolutely, absolutely. One personal question, if I may. I know you have two lovely children. How do you manage your personal life and with all the additional responsibilities? How does it work out for you?
Yeah, that's a question I often get because I have my full-time job, but I also do coaching on the side. So I actually do executive coaching, working with leaders, working with other professionals, helping them to become better in their, in their own jobs, in their own lives. So and I mentor and I volunteer. So it's a lot of things that I am doing with the two kids who are 3 and 6 years old. And I would say, I've learned it wasn't easy at first. Like when initially I was struggling because I wasn't, I felt like I wasn't doing my best at work, at home, everything was not the way I'd like it to be. And the lessons that I've learned is you really have to negotiate boundaries. You have to negotiate expectations with your spouse. So you have to know what is important to you. You have to then, prioritize what's important to you. You have to communicate with your spouse. So be able to sit down, openly talk to them, to let them know what is important to you, what is important to them, listen to them, hear them out, and then decide what's going to work as a family. So for me, I've, my spouse and we've chatted, and I said my career is really important. This is what I want to be accomplishing, and he's been very supportive because without his support, I wouldn't be able to do all the things that I'm doing. For the past 2 years, I've been taking courses on the weekends. I've been seeing clients in the evenings. So it's a lot of that time where then he has to take up that, sole parent responsibility. And that's how it's been working. So, having those expectations being communicated and having those boundaries where you both understand each other and you're supporting each other. Otherwise, it's not going to work. It's really, really hard. So I would say that's the biggest lesson I've learned, where you need a support system. So if it's not your spouse, then maybe your family, if you have parents around, if you have siblings, anybody else, or then if you have the finances to hire help, hire a nanny or hire external help or daycare, something like that. I know everything is so different now with COVID, but those are some of the ways that has worked for us, I'd say.
Absolutely. Amazing, amazing. One last question for you, Shiyen, is the fact that for those folks who are moving into Canada, and I know you talked about it earlier as well, specific to the profession, but in general, what would be your advice for all those folks?
So if you are coming here, I would say, when you're coming to a new country or foreign land, we always have those dreams, right? We're coming here because of that better future, that better life, either for us, for our family, for our children. But when we arrive here, sometimes it's very different from what we've dreamt up, right? The reality is different, the challenges are different. So I would say do your research. So really understand what it is you're coming to. So, the positives are there, but there's also lots of negatives and challenges that you should be aware of. So as long as you're aware of that and you come with that open mind to learn and work hard and do the right things, I think you'll make it here. But often we come here and what happens is you don't get the job, you don't have work, you're out of money, you're running out of money, you have all those pressures, and then your confidence drops, you get depressed, like mental health, everything, and then you go into this vicious cycle. So I would say, just make sure you do your research, you understand where you're coming, what the opportunities are for you in your profession, and what are some options that might be there when you come. What's the worst case scenario for you? Say if things don't work out the way you expect, like what is it that you can do to support yourself? And when you come here, network with people, because back home networking wasn't something that we were taught to do. So in North America, especially here, most of the jobs are, you get them through networking. It's through somebody that a contact, or a contact's contact. So you have to go out there and meet people. You have to, build those relationships so that people can let you know when there's opportunities, can refer you, can let you know about how the Canadian culture works, things like that. And then once you have all of those support systems around you, then just go for opportunities. Take positions that may not be, you might not get the exact same level of, if you were a director back home, you might not have that same director level position here. But I would say take that opportunity and then work and show what you've got to then climb up the ladder in that particular organization. So those are some of the things I'd say.
No, absolutely. That absolutely makes sense. But thank you so much, Shiyen, with sharing your experiences and your insights. And I'm sure people watching would be able to benefit. So thank you so much for doing this today.
You're most welcome. Thanks for having me, Seth.